Hey, how are you this morning?
I'm good. How are you?
I am good. We are at the Decatur County Memorial Hospital Healthy Fair. Marie Menchhofer with us,
Yes.
and you are a family nurse practitioner and recently came on board at Decatur County Memorial Hospital. Marie, I want you to just tell us a little bit about you and a little bit about the practice that you are in.
Yeah, so I'm so excited. I just started seeing patients probably about, this is my week 3, but I'm at Tree City with Decatur County, and I do family practice. So I'm a family nurse practitioner, and so it's so exciting. I can take care of the entire family, from little babies to the elderly and everybody in between.
I love that.
Yeah.
All right. So, give us a little bit of background about your family and where you grew up, things like that.
Yeah, so I currently reside in Versailles, Indiana. Love our small town and our community. That's where my heart is, taking care of the small towns. But I am a very blessed mama of 2 beautiful little girls, ages 9 and 11. And then I'm happily married to my husband, Casey. We've been married almost 15 years now, but we've been together for 18. So,
Cool. Very
yeah.
nice. So, you previously, before coming to DCMH, what were you doing at that point?
Yeah, so for 12 years, prior to becoming a nurse practitioner, for 12 years I served as South Ripley's corporate nurse and health coordinator there for the school corporation. Loved every minute of that. Once again, serving small town, rural community. And it was nice. You know, you get a lot of experience in pediatric, adolescents, and adult health as well,
Sure.
along with community health and patient education. So it really kind of set the groundwork for what I'm doing now. So
Really working with the families then, as you
absolutely,
do now.
absolutely.
So, I love the idea too, as you said, from babies to geriatrics, and
Yeah.
basically, I mean, we're looking at you can do 2, 3, and 4 generations of one family, and
Yeah.
I think that is ideal for the caretakers and that type of thing. So,
Yeah.
all right. So I know you're taking new patients, and so
Yes.
how would someone schedule an appointment with you?
So they would call over at Tree City and just let them know that they're looking to establish with me, and they'll get them scheduled.
Okay, very good. And that's 812-222-DOCS.
You got it.
All
Yeah,
right,
that's
I love
good.
it.
That's
All
good.
right. All right, Marie, thank you so much. You'll be here at the Healthy Fair this morning, so
Yeah.
folks can meet you if they want to stop by.
Yeah, I encourage everyone, come on out and say hi. I'd love to meet the community members here. I'd love to meet and greet with you. I'll be here for the whole duration of the Healthy Fair, along with a lot of our other new providers. So come on out.
All right. Thanks so much for being with us this
Thank you. I
morning.
appreciate it.
All right, you're back with us at Greensburg Elementary, Decatur County Memorial Hospital Healthy Fair. Kelly Miller joining us.
Yes.
How are you?
I'm great. How are you?
We're good. So, Kelly, tell me about you.
All right, well, I am a fairly new family nurse practitioner at Tree City Medical Partners. I started at the beginning of this year. I am. I take care of all ages, infants to the elderly, and take care of chronic issues and anything in between. Well care, acute visits.
Okay, and you're at the Tree City Medical
Yes.
Building. Okay.
Yes.
All right, so tell me a little bit about you, your family, your background, just a little bit.
I grew up in Indianapolis, went to school there. I live in Greenfield, which is just a nice little drive from here. Did a lot of my clinicalship with Dr. Munkle and Shelley Walsman at Tree City, and so that's how I met some amazing people down here in Greensburg, and I just love the community and decided to take the position they offered me once I graduated school.
Very nice. All right. So your first healthy fair, obviously.
Yes.
So I know a lot going on, and I'm sure people probably can hear a little bit of the excitement in the background. So can you kind of give us a little tune in as to what they're going to find when they get here today?
Yeah, we have members of their organizations in the community coming here today to discuss their what they have to offer. We have the cancer screening portion of the fair just down the hallway that talks about colon cancer, lung cancer, any the different kinds of more common cancers that are found in the community. And we also have lab draws that we check lipid, thyroid, A1C, which is your the diabetes lab that we check, and a complete blood count. So you can get that done today, and just get online and sign up.
Okay, so I have to ask a quick question.
Sure.
I know they, say fasting is better, but if you haven't fasted, you're still okay to at least do that,
yes,
right?
Yes. Yep, you don't have to be fasting to come in today. Actually, they would like for you to have something to eat or drink. That's right. Yes, we do not need to be fasting for that.
Okay.
We also have some great speakers. We have Matt Weber, who's speaking on behalf of his diabetes education. He actually meets one-on-one with patients, but today he's discussing what he goes over on a regular basis. We have one of our providers from the Well Clinic talking about, different things that might bring you into the Well Clinic and what services you might find there. And then we have a couple other clinics or speakers throughout the day to educate the community.
I like that. I'm anxious for the walkthrough in the colon.
Oh, that's really neat.
I mean, that's really to me like we've got a really cool opportunity to see this because visualizing sure makes a big difference when you're talking about your health care.
Definitely. So that inflatable colon is wonderful. It shows you what a normal colon looks like, and then it shows you what the early stages of cancer, late stages of cancer, but also other diagnoses and medical issues that you can have with the colon. And so it gives you a nice visual representation of what that is, so people can see like, oh, that's what possibly be going inside of me. So yeah, come check it out. The fair is open from 8 to 11. It's going on right now. Anybody from the community can come down.
All right. And we want to keep reminding everybody there's no cost associated.
Right.
So this is free. The hospital, along with their sponsors, puts all of this on. So there's no reason not to come out and join us and take care of all this. So, all right. Well, Kelly, and you're accepting new patients?
Yes, I am accepting new patients, all ages. Anybody can call, make an appointment with me, Kelly Miller, and I'd be happy to see them.
All right, so just call into the direct 222 docs and tell them that you want to see Kelly, and they'll get you set up.
Definitely.
All right, thank you for joining me this morning.
Thank you.
Okay. All right, Sandy, back to you in the studio. We'll be back in just a few minutes and visit with some more of our providers from DCMH. All right, we're back here at the Healthy Fair.
We
Look-
are.
Look who I found.
The tables have
The
turned.
tables have turned. All right, it is the Healthy Fair at Greensburg Elementary School. Go until 11 today. Decatur County Memorial Hospital.
What a crowd.
And guess who? Emily is here with us. So I
I
will
am.
do my formal introduction.
Okay.
Emily Versman, family nurse practitioner with Decatur County Primary Care.
I am.
So you're here this morning at the Healthy Fair, and you're one of the presenters.
I am. I'm excited. I was asked to do that this year, and we are going to talk about health and wellness, something that I find very important. Just the simple labs. I always say, know your numbers. Know what your numbers are. They tell you a lot. And I think people are becoming more aware of that because initially people didn't care. Numbers didn't matter.
Yeah.
But we've found so much prevention by looking at lab numbers, lab values.
Well, and too, I think, and I've talked about this a lot across the country. The obesity rates have gone up, the diabetes, people being diagnosed with that. The stress amounts, and you see the blood pressure issues and all of that. So,
Heart disease, a big one. Just last week, I think it was in the news, the prediction of, I think over 50% of Americans are expected to be diagnosed with heart disease, in the
Especially
next few
women.
years. Yeah, the rate for women is very high. You talked about diabetes a little bit, and I know Matt Weber will be on in just a little while. What a great asset he is to DCMH. He works well with us. So I normally see my diabetic patients every 3 months, but he's able to follow them if they're willing to be a participant in his program, where they can. He helps them with their medicine, he helps them with their diet, exercise, all of those things in between those times that I see them, so that we can confer then, okay, what are we going to do with them? What do we need to change to get them to their healthiest point? So, and also labs, starting about 15 or 16, labs are a good idea. We're finding high cholesterol. We're finding high fasting blood sugars.
genetic factors.
It is.
into
And,
that.
I always tell people you might be 100 pounds soaking wet and still have high blood pressure and high
Right.
cholesterol. It's not looking at the outside of a person. It's that inside part.
Knowing how their makeup is. So, you see all ages, right?
I do. 0 to the end. Yeah.
Uh-huh. All the way across. And then you also work really close with Dr. Dar.
I do. So that's been a great collaboration for me, and that started a few years ago. And Dr. Dar and I both joined DCMH almost 2 years ago. It'll be 2 years ago in October, and then she came in January. But we more or less back each other up. But when she's not there on Fridays, but so I take care of her patients then. She's taught me an enormous amount about pediatric care, and what a phenomenal doctor. There's days I'm like, where'd you learn that? How did you know that?
And she's an awesome cook.
And she's
too.
an amazing
Yeah.
cook. She is.
Yeah, that cinnamon bread was over the top. So,
Yeah, she's a very good cook. So yeah, it's been a great collaboration, and I'm happy to be a part of DCMH. It's been a lot of great eye-opening things that we've been able to do for our patients that have come along with us. So
are you currently accepting new patients?
we are, yes. I say we because Jenny's my right-hand man. She's my medical assistant, and the other girls out there do a great job as well. But accepting new patients, and again, any and all ages. So I do, before I forget, and I was talking with Liz McCoy earlier about this, the heart and lung scans I think are a great thing. They catch so many things. Whether you were a smoker or not a smoker, maybe you worked in a factory where you were exposed, or a farmer, those kind of things. The lung scans and the heart scans, I think, are both $49, worth every cent of that. The heart scan looks at your arteries so we can see, are we building up? Are we close to having an occlusion and need a stent? Maybe save you a heart attack, which would be a great idea.
That would be a wonderful thing, yes.
It would, yeah. So those you can actually sign up today to be registered to win those through the radiology booth.
Oh, that's awesome.
So I believe it's in the Cancer Prevention Hall, which sounds very exciting. I haven't got to see the inflatable cooling yet. Have
I know,
you?
it's on my list. No, that's what I'm doing here in a little while.
I know. There's so much I want to see. I walked in, and it took me a minute because I tend to chat on the way in. So, but the turnout's just phenomenal.
It's been great. I know a lot of folks here to get those labs done, and I know there's a line, but all you got to do is get in line and get your name in there, and they'll get to you.
They will, and they're moving through it very quickly. And again, those labs are what we need. Those show your values. I know we're doing lipid panels today. We're doing A1Cs as well.
CBC, and there's like 4. I know.
Yeah, they're all great. And again, we're looking at your
Thyroid.
numbers. Thyroid, that's right.
Yeah.
And that's one that I've seen more in the post-COVID world, that people's thyroids have just quit. They've just stopped. I don't know why. I don't have a reason for it, but they've just kind of quit. So we're finding those thyroid numbers, they're coming back wanky one way or the other, either hyper or hypo, but we're able to correct that. And a lot of people say, I was so tired, I had no idea. And it's something you don't know. It just kind of, it can just kind of happen. Yeah, it just can kind of happen. And sometimes it is genetic. It runs in families. So and I see it in kids as well. So it's not limited to just adults that thyroids have a little dysfunction. So yeah, all of those things are going on today. And
on the heart scan and lung scan, real quick, do you have to have a provider prescription for that, or can you just call and schedule?
You can just call and schedule that. Now, I do think they'd like to have you have a provider to send their results to. And so if you don't have one, they'll help you get that set up. I know there's several new providers at Tree City, as well as primary care and Decatur County Family Medicine now, which I think is super exciting.
Yeah.
So a little jealous they got to go in the new building, but but they'll help you find a provider if you don't have one. But you don't need an order for that. That's something that you can just call and get signed up for.
Very affordable.
It is. Very affordable, and it can save your life. So.
Absolutely. All right, Miss Emily, thank you so much. I know you are presenting at 9:30
9:30 today. Yeah, I'm excited about that. Again, we're going to talk about health and wellness. So if you haven't made your way out, you can get here in time.
The library?
Yep, we're in the library. I think Matt Weber's working on his presentation right now. I know that's going to be a great one as well. And
yes.
Dr. Federley may be up next for his presentation, then, which I think is great. And he's recently joined as well, so talking about bone and joint health.
Okay, very good. Because doggone it aches when your shoulders, elbows, knees, toes, and hips start getting that old age to it. So.
That's right. Well, I tried to stay on my side of the table this time, but I think I crossed over.
All right. Well, thank you for joining me this morning. And again, 9:30 you'll be presenting.
Yep.
And we'll see you on down the road. Maybe we'll see you out in the walk through Colon.
I know. I'm excited. Before I leave, I'm going to make my way through the Colon.
Yeah. Morgan and I are going to take a tour here in a little bit. So, all right, Emily. Thank you.
Thank you for having me this morning.
All right, we're back. Good morning, Sandy, in the studio. I have talked to Deanna, hadn't talked to Sandy. Morgan, thank you for being here this morning. Matt Weber's joining us, one of our favorite
Kathy.
guests at WTRE. How are you?
Good, how are you?
I'm good. So you just finished your presentation this morning here at the Healthy Fair. So tell me a little bit about what you kind of talked about with folks.
We talked about the diabetes program at the hospital and the resources for people in the community to get help for their diabetes. So the diabetes program, you can get one-on-one counseling with myself in my office. You can get one-on-one counseling with the dietitian, to focus on diet. And then we run a program that's 2 hours every Wednesday for the first 3 Wednesdays of the month. We do that every quarter. It's a diabetes education class, and that's billed to the insurance, but the dietitian and myself teach that, go over all the different things, ins and outs of diabetes. It's 6 hours of education.
Oh, wow, yeah.
And lots to learn. We feel like we have to pack it in even to get that. So there's a lot of material for diabetes, and people just really I don't think they really understand how much is involved until you have the diagnosis, until you're like, oh my gosh, there's so many resources, there's so much information. What do I believe and what don't I believe? So we try to give them all the research material and all the little things to help them with diet, exercise, reducing risk, taking the right medicines, understanding the medicines, and that's been great. One-on-one sessions with me. I've been doing this for a year and a half now, and I've really found that, when people see the doctor every 3 to 6 months, they talk to them for a few minutes, give them a new medicine. There's a lot happens in that time frame, and if your blood sugar is not under control, or you're confused about diabetes, meeting with somebody like me or the dietitian or anyone else in between to get more information has been really beneficial. I help them understand diabetes better. Again, diet and exercise, what they can do to make their body
lifestyle changes,
and then help them understand what medicine and how much, maybe they can't afford one of the medicines, figure out which medicine works, give them a glucose monitor, that they don't have to prick their finger anymore, try to get them a continuous glucose monitor. And those folks do so much better when I can meet with them in between visits.
Sure.
So
I think one thing too, Matt, is people understanding how all of those factors affect your sugar.
Yeah.
Because I think a lot of people don't realize, especially when they're newly diagnosed, it's not just what you eat, or it's not one single thing. It's all of those things that combine to affect that. So to me it's important, and because I've had a family with those issues, it's something it's not something you just do and go on. It's a 24-hour a day, always.
It's a lifestyle. Yeah. And once the person understands all those things and figures out what works for them, then it just becomes their new normal. And once they've got to that point, that's my overall goal. Like, get them to a point where they understand the diet and the exercise. They're doing those things that they can do to improve their sugar, and that just becomes their new routine.
Yeah, this is the way you live.
It's not a diet. Yeah. It's just a new way of new lifestyle.
For sure.
So.
All right. Well, so tell me, one thing I want to ask you: do you feel like that there are just more and more people being diagnosed with diabetes? Do you see an increase in that?
There's a huge number of people diagnosed with diabetes around here. Type 2 diabetes is obviously the most common. And it has a genetic factor to it, but the good news about type 2 is we can actually do some things to improve our sugars.
Sure.
So staying away from regular soda and fruit juice is one of the main ones I see, like, hey, let's just cut that right out. It's just so much sugar.
Sure.
Getting the proper amount of sleep, reducing stress, losing weight, exercising, eating healthy.
A lot of pieces to it.
Oh, yeah.
Yeah.
A lot of people don't realize that sleep affects it and stress affects it. And so I try to talk about all those different things and what you can do to improve those things and really just live a healthier life. And it's more than just the diabetes piece.
Sure.
So
yeah.
I feel like I've had really good success meeting with folks and just kind of being a partner and a coach to them, and kind of I basically send the notes to the doctor, and we kind of have conversation and communication and touch base with them on a regular basis through the process.
Kind of the resources and the support they need to get on track. So.
Yeah.
All right. So if someone has been diagnosed or concerns currently, we're working through this, how do they get an appointment with you?
So it doesn't need a referral. You can call my office directly, 812-663-1217. I schedule my own patients and meet with them. I'm there 8 to 4:30 Monday through Friday. Sometimes after that, if it's like, I can't get there by 4:30, I've stayed late to help, to meet with people after work.
Okay.
Usually I meet with people the first time, and it's like a 1-hour diabetes education crash course.
Sure.
And then after that, I can meet in my office or follow up over the phone.
Oh, okay.
And that makes it a lot easier for
Sure.
a lot of folks that maybe don't live in Greensburg.
Okay.
But I basically work with all the local doctors with the hospital and team up with them to try to help these folks get their sugars better.
Awesome. So do you need to have like insurance or anything like that to schedule with you?
So for the different programs, meeting with me one-on-one is no cost, which is awesome. The hospital pays me to do this just to help our patients have better health and outcomes. Meeting with a dietitian is billed. Doing the diabetes education classes with me and the dietitian is billed to the insurance. And then the Way Beyond program that the dietitians do is $125, and it's a 10-week program.
Okay.
So that's the other thing that they do that have had good success with. And then the other things I do is the Medicare reviews in the
Sure.
fall time. I've been helping people with some weight loss as well, some counseling with that, and some smoking cessation. So I've taken a course on smoking cessation. If you've had a terrible time quitting smoking, if you want to, I'm a good resource for that too.
Awesome.
Had some good success with patients being able to quit smoking, and so just trying some different things than just the patches or the gum or whatever that's
Sure.
available over the counter. So
Yeah. Making our community healthier.
exactly.
Yeah, absolutely. All right, Matt, your phone number again to schedule
Yeah,
with you?
812-663-1217.
All right. Thanks so much for
Yeah,
being here this
thanks for
morning.
having me.
Good to see you.
You too.
Thank you. All right, we are here at the Healthy Fair. Wonderful turnout this morning. Rex McKinney's joining us, CEO at Decatur County Memorial Hospital. Busy time, Rex.
It's extraordinarily busy this morning, something we like to see every year here in June and in Greensburg and serving our community.
It's a wonderful event. I know it's been going on for several years now. The hospital has, and it's all free. And I think that is just wonderful that you guys can continue to offer all these services and the community can come out and take part in it.
Yeah, we take community service very important, and this is a great way every year that we connect directly with a few hundred people that come out for the free screenings that we offer. There's some great educational activities with our providers. I know Matt Weber was just on with you. He had a great crowd in there talking about diabetes. Dr. Federley, one of our orthopedic surgeons, is presenting right now with a group in there talking about orthopedic needs for our community. So yeah, it makes us very proud to see that the community comes out and supports us, and we're doing great things for the community as well and filling those healthcare needs.
I like the opportunities with the presenters because, a lot of times with our visits, like we'll have time with our provider, but then you leave and you think, oh, I needed to ask this, or, this comes along. And it's kind of nice with, the presentations where you have a little bit more time in those questions. You can kind of process those before it's over and just to be able to talk a little bit more in depth.
Yeah, it's more of a conversation. It's a community conversation, and individuals can ask those questions that we may not think of and get some great answers from our providers. So
Sure.
and it's very casual, low-key atmosphere. So
Very nice. So the Healthy Fair will go until 11 today, and you've got several vendors that are out here with a lot of community education and that type of thing. But I have had a wonderful opportunity to meet several of your new providers that have come on board. And you want to just kind of talk a little bit about that expansion with DCMH?
yeah, it's really exciting to add physicians and nurse practitioners, and we've done a fantastic job over that over the past few months. One of the major gaps in healthcare is access, just simple access to providers. And oftentimes, and what we were experiencing in our community, that our community was telling us that they're waiting too long for appointments. And so we put out an effort to recruit new physicians and new nurse practitioners. And Kathy, I'm here today to say that I'm very confident if someone contacts our 812-222-DOCS line and requests an appointment with a provider today, they're going to get an appointment today. So we're in a great position to improve access. We've worked really hard with that, and we've hired some outstanding providers. As you know, you probably met Dr. Yelinich as well as Dr. Stefan. They're both part of our community. They live in our community here. They take community service and healthcare very seriously. And we've also added some fantastic nurse practitioners. I know Laura Greiby, Megan Israel are just a couple of them.
Yes.
So we've enhanced that access to care. Access to primary care is extraordinarily important for communities like ours. And I'm very proud of what our Decatur County Memorial Hospital team has done over the past few years in adding specialty services.
Yes.
Much of our community doesn't know how blessed we are to have significant specialty services. And our hospital here locally offers approximately 20 specialty services right here locally. So we've taken access to care, access to primary care, access to specialty care very seriously. And that access to great providers is also supported by a great support staff team as well as technology. You've heard me talk about some of our fantastic diagnostic radiology technology right here locally. We have some outstanding equipment and technology for our providers to care for people.
And that's an ever-changing piece of it, too, isn't it, Rex? A continuous, updates, upgrades, and new equipment because the world changes so quickly.
Yeah, the technology advancements in our society have just been extraordinary, and it is difficult at times to keep up with that pace because it is extraordinarily expensive. But I'm very proud to say that we've been able to do that here locally with some great MRI, CT scans, great ultrasound, fantastic mammography support services. And today one of our featured services here is our laboratory service.
Yes.
And that's so important from a diagnosis standpoint. That we have an extraordinary lab team that provides the breadth of laboratory services for our providers and our patients in need.
Well, the community benefits so much for that. Because, as we've talked in the past, how many times is someone that puts those things off, doesn't do that because they can't afford it, but yet they could come to the Healthy Fair and then something's detected, and so it's given them that inside track to get some care that they otherwise may not have.
Yeah, one of the things that we are very mindful of is that the health issues are out and present in our society, and screening definitely exposes those.
Yes.
Historically, screenings expose those individuals receiving screenings, about 30%, just over 30%, uncover some type of medical issue that needs to be addressed. It may be hypertension, it may be a high blood sugar, lipids may be high, that sort of thing. So we're just very pleased to be able to offer the services. We do this once a year, every year, that, and it's just an extraordinarily popular event that our community appreciates, and we're so proud to be able to do it.
Yeah, very important.
Yeah, as you know, there's a significant cost associated with this, but as a community hospital, we take community service and caring for our community very seriously, and we're glad to make the commitment that we've done today and every year.
We're just very fortunate as a rural community, as you said, to have those specialists that are here. It's the primary care availability, the testing and all of that, because so many people, when you start to look at it, having to, make the drives to the cities, the bigger hospitals and all of that, when you don't feel well, you don't need that. people, a lot of times transportation's an issue, you know,
Exactly.
so it's a really good thing for our community, and people need to realize how blessed we really are to have all of those.
Yeah, I have these kind of conversations very frequently with local individuals as local leaders and that sort of thing, to bring awareness of truly what we do have in our community, and we're striving to get better every day. But those specialty services, that's unique for a community hospital like
Sure.
ours. If you look around the region, look around the state, look around the nation, hospitals like ours have typically struggled. We certainly have our challenges, but we have a great healthcare system here locally, and we want to spread that message. And one of the things I'm so grateful for is how our community has supported Decatur County Memorial Hospital. And it only comes with days like today. If I look around in here, there's multiple community members, different vendors, and it's all healthcare related.
Yes.
How can we improve the health and wellness of our community? And all these community members just come out and support what we're trying to do, and support that mission with connecting with our community and making our community healthier.
And it's a wonderful opportunity too. As you said, we have so many representations of the hospital, but then we bring in so many pieces that are the resources and the different things that we need to complete for all different levels of our community.
Yeah.
So to bring them all together in one building is an extraordinary feat, number one.
Exactly.
So, but and Liz has done a wonderful job of putting all of this together.
Yeah.
So we thank Decatur County Memorial Hospital for making this annual event something. A lot of people plan every June. This is, they're going to take care of some things. So.
Yeah, we want to be there for our community, and this is one day that we really celebrate, because we know there's some needs in the community. And one of the things I'm mindful of is how many individuals are walking through the door each day, because it does help us gauge the need in our community.
Sure.
And it also lets me know how much is our community supporting us and our events and that sort of thing. So historically, there's been 600 to 800 people show up for this event.
Which is
and
awesome.
I walked in about 40 minutes ago, and we'd had over 200 come in. I want to encourage the public to come on out. If there is a wait for blood draws and that sort of thing, there's plenty of other activities and booths to visit.
Sure.
Just come on out. There's plenty of parking. If transportation or mobility is an issue, we have some support in the parking lot with golf carts to get people to the door where it's easy access.
Yeah, and it's a good building. It's easy to get around, all one level, easy to get around. On my agenda is going to be the walk through colon, because I hear that in the new cancer prevention hallway. So Morgan and I are going to go take a tour of that after a while, because I think that's so cool. You guys have brought things like that. It's that visual. So.
It is, and that it's about educating our society and our community on what's really important from a health and wellness screening standpoint. And I want to thank you as well, Kathy. WTRE is a great partner in our community, and I'm glad you're here, and with all the other partners and helping us promote health and wellness in our community.
Rex, thank you for being here with us today.
You're welcome. Thank you.
All right, you bet. All right, back here at the Healthy Fair. Busy place.
It is very busy today.
Very busy. Monica Livers joining us, family nurse practitioner. And Monica, you are based out of the
Media Care on Michigan Avenue. So 955 North Michigan. It's Tree City Medical Center is in the front of our building, and we're down the hallway in the back.
Okay. So tell me a little bit. First, I want to know a little bit about you. Tell me about your background a little bit.
I live in Oldenburg, born and raised, married, 7 kids, got my bachelor's degree from Marion University in Indianapolis, and then worked in labor and delivery for 18 years. And went back to school and went to Indiana Wesleyan. So I've been here at Decatur County for 7 years.
Have you really?
Yeah.
Okay, so you went from labor and delivery to immediate care. Tell
Yes.
me a little bit about how that transition happened.
Well, I used to work here at DCMH in the labor and delivery unit, and also at another hospital. But so I worked here for 5 years, and it's a great place to work, and I like my job, and I love the patients, and
So did you just, because labor and delivery, I mean, that's pretty specified. So you were just kind of ready to broaden the horizons a little?
Yeah. I miss it. I love it. I love when the babies come in now, and
Sure.
I'll take them.
Sure.
And it just worked for my family. A little better hours, and I get to be home in the evenings with my kids.
With your
And
kids. That's a big thing. Yeah. So tell me a little bit. We talk about the walk-in clinics, what I've always called it, but so there's different things that people need to think about. So most people have a provider. If you don't, we can find that provider for you. But sometimes my child's going to come home from school with a fever, and it's late in the day. But yet there are other more like critical things so we need to learn to weed out where we need to go. So can you talk about that a little bit?
Sure. There's, I guess you have 3 different options. So if it's not, if you have time to make an appointment with your primary care, always the best option, because they know you, your history. And so that would be option 1. But if it's kind of last minute and it's not a true emergency, we can take almost, we have wide option of stuff we can see. And we have extended hours past the doctor's offices. So we're open 8 to 6, Monday through Friday. And then on the weekends, we're open 9 to noon. Okay. So more hours than the doctor's office. And you just have to be checked in 15 minutes before we close. And
is there a chance to schedule ahead?
Yeah, we started that recently, so you can self-schedule as long as you have access to the portal. So that's a great option that started recently. Just if it's a true emergency, though, you need to go to the ER. But you sure can self-schedule. You can't pick your provider at our clinic, but there's wonderful providers there. There's usually 3 or 4 of us working a day. And you could pick a 30-minute time slot, and it kind of cuts down on the wait time in the waiting room. So that's a great option.
So tell me, let's weed out with some symptoms. Where to go?
Yeah. So for the immediate care, you sure can come for like common illnesses. So we test for we test for flu, RSV, strep, COVID. We can do, UTI symptoms. We can do minor scrapes, burns, stitches. If you have, your child fell off the swing and you need an x-ray, we can order that. We can refer you to specialists. But if it's an emergency, if you're having chest pain, shortness of breath, if you have stroke symptoms, like the ER is definitely the option you need to go with.
Okay.
Yeah.
All right. Now, you doing a presentation this morning?
I am at 10 o'clock, 45 minutes from now. I'll be talking here and answering some questions. Yeah.
Okay, very good.
Yeah.
So you are, walk-in clinic is located at the Tree City Medical Arts Plaza.
Yeah.
Again, but you can self-schedule. You can just come if you need your services. Just come in. And you said again, Monday through Friday, the hours are
8 to 6. Make sure you're there 15 minutes ahead of time before we shut the doors. And then on the weekends, 9 to 12.
Okay, very good. All right, thank you for joining us this morning.
Thank you. Come on out to the Healthy Fair. Lots of vendors here.
All right. And you'll meet Monica at 10 o'clock in the library.
Great, thank you.
Okay, thank you. All right, thank you, Morgan. We've had a busy morning. We're at the Greensburg Elementary School. It is the Decatur County Memorial Hospital Healthy Fair. Dr. Federley joining me this morning. Good morning.
Good morning.
So, orthopedics, correct?
Correct. Orthopedic surgery.
Okay, and I think you just did your presentation a
I
little
did.
bit ago in the library?
I did. We just did a real quick talk on joint pain and some of the real simple solutions before the doctor's appointment and the surgery or anything else like that would come into play.
Okay, so as I get older, I can understand when people are like their achy shoulders, achy hips, achy knees, those kinds of things. And so I know you are the guy to help out with all of that. Can you give us just a few little pointers over on the air to
Yeah,
maybe avoid some of that?
sure. Well, a lot of what I see is definitely wear and time. But of course, there are younger patients that have joint pain that can be from other kind of more serious problems and things that we do manage that as well and work those types of problems up. But for the average person, a lot of times activity modification, nutrition, hydration, exercise and special exercise to work with strengthening the joints and to help with stiffness is beneficial. And then in some cases, over-the-counter medications can be beneficial to help with a good portion of just a mild or mild-moderate arthritic pain. And then lastly, if nothing else works and all the other studies that we use to work up the pain say that surgery is indicated, then those are the times where we go off into that pathway.
So joint replacement, can we talk a little bit about that? Because I know it has really evolved over the last few years.
Yes.
So tell me a little bit, like if I, shoulders and knees and hips.
A lot of it has to do with the pain treatment pathways now. It wasn't uncommon 5 years ago, 10 years ago for patients to be in the hospital for 3 days after a joint replacement. Nowadays, with a lot of the anesthesia and pain management techniques, regional anesthesia can be used so that patients are able to go home the same day after their joint replacements. And so that's a big component of it all. Some of the materials we use for the surgeries have changed a little bit, the bearing surfaces that last longer. And then some of the techniques with the surgeries, a little less invasive, more muscle-sparing type of procedures to help with recovery and quicker recovery from therapy and getting back to activities.
So if we have someone that is listening, maybe having that continuous hip or knee issue, what is the kind of the path they need to follow to get to you?
Yeah. Normally, we will take referrals without referrals. So you can be self-referred. You can call to the office. Our main office is in Columbus, but of course we have the office in Greensburg. We have an office in Seymour and North Vernon. But call to the office and we'll arrange an appointment. Normally that first appointment is getting the history, the examination, x-rays are part of that, just to get a good diagnosis. And then from there we work off of that to know what the next step is going to be, as far as could be something very simple or if there's more testing.
Okay, very good. So you don't have to live in the pain and discomfort.
No, that is my job, is to get people back to the things that make them happy, their activities that keep them going.
All right, very good. Dr. Federley, thank you for joining me this morning.
Thank you.
All right, back here to the Healthy Fair, Dr. Isaiah Steffen. Nice to meet you.
Nice to meet you too.
Thank you for joining me, and welcome to our area. How long have you been here in Greensburg?
I've been practicing here for 6 months now. Moved in December.
So can you tell me a little bit about your background and your family?
Yeah, I'm originally from the Sunman area. Did my training all through Indiana. Ended up moving out to South Carolina for a little while, and now we're back in the area, and I'm happy to be back to provide my services and meet the needs here in Greensburg, Indiana.
Very nice. All right, now you are housed at Tree City Medical, is that correct?
Yes.
All right, and you do family practice, you also do OB. So tell me a little bit about your practice and how long you've been doing all of this and what ages you accept as far as family practice.
So I accept all ages of patients, from birth all the way to end-of-life type of discussions, as well as, like you said, maternity care and obstetrics. I've been doing this for 8+ years now, and it's always a privilege to care for any patient of any age. I also specialize a little bit in mental health when it comes to the primary care setting, and women's health as well, including birth control and also pregnancies.
Okay. So do you keep track of how many babies you've delivered?
Yes, I have a log that I keep track of. I'm up to about 220.
Awesome. I used to work OBGYN in a private practice with one, and we loved that because that was just such a celebration, you know, when you deliver that new baby. So, all right. So family practice, and you are accepting new patients.
Yep.
Okay.
All the time.
All right. So they just need to call and get their appointment.
Yep. The phone number is 812-222-DOCS, which is, I don't have the actual numbers on that
Yeah,
sheet.
you just have to, poke it out there on the keypad. And
Or you can go to the webpage at DCMH.net and search my name, Dr. Steffen, or also see any of our other great providers that are listed on that webpage.
Okay. And I do want to let folks know you tell me you're bilingual.
Yes, I do. I'm also fluent in Spanish, so I'm happy to take all those types of patients as well. We can let them know that we have a full fluent Spanish-speaking provider in the area who is accepting new patients. And
Okay, very good. I have to ask, you started out family practice. Was OB part of that from the beginning?
yes, I chose my training programs based off of my love for doing women's health and taking care of babies and pregnancy care. So I've been doing it ever since I was in training all the way through to now.
That's awesome because there is such a shortage of women's health care available throughout the country, and so it's great to know that you've got, and especially when you're able to use your bilingual talents also with this. So.
Yeah. I was drawn to this hospital in particular because we still offer community-based women's health and obstetrics in the community, local, where women can get to a hospital in quick order instead of having to travel so far. There's so many areas in the country that women are having to travel 2 to 4 hours to.
Isn't that amazing that we live in the world that we live in now, and we still have those kinds of issues.
Yep, and we're here local. Most of our patients travel 30 minutes at most or less to come to our hospital.
And we have everything that they need here.
Yep.
So, all right, Dr. Steffen, it's very nice to meet you.
You too.
And we encourage folks to call if you'd like to schedule an appointment, and if you're looking for someone for your OB care, this is a prime opportunity. So, all right, thanks for joining us today.
Thank you very much.
All right, here we are at the Healthy Fair. Jill Prickle joining me, a nurse practitioner, and you are at Tree City Medical. How long have you been with DCMH?
I've been with DCMH for about 7 years. I started off working in their walk-in clinic, so I seen patients of all ages for about a year, and then they started a new position where I was rounding on the majority of the local nursing homes in the area, going in and helping the physicians out, seeing some acute and chronic issues, and taking care of the nursing home patients in the area.
Okay, Jill, tell me a little bit about your background, your family, and
I'm from Batesville, Indiana. I'm married. I have 2 boys. I'm about to become an empty nester. My baby just graduated, so
yeah, times change, don't
yeah,
they?
yeah.
So you just recently then have transitioned over to more of family practice, private practice for yourself, right?
Yeah, so now I am located at Tree City Medical Partners. I've been there for about 3 months. I see patients the age of 5 and up. Like I said, I have a lot of experience with the older population and the geriatric population. Looking for new patients, usually can get in the same day if need be. So,
Okay. All right. So at Tree City Medical, do you self-schedule at all?
no, we don't.
Okay.
No.
So they need to call into that
yes.
222 docs number.
Yes, correct.
And get set up. But you
Yeah.
are taking ages 5 and up.
Yes.
So tell me a little bit about what got you into healthcare as your career. What was there any certain thing, or what was your choosing that you did that?
I just always been passionate about healthcare, and I think especially like in rural communities, sometimes there's a lack of healthcare opportunities, but Decatur County does a great job with promoting, community events and doing screenings and preventative care. So it's just something I've always been interested in.
Mm-hmm. And just continuing now.
Yes.
So big transition from what you were doing to this, but
Yeah.
sounds like it's going to be a good.
Yeah, I'm loving it. So, like I said, if anybody's in need of a new family provider, there's a lot of new providers at Tree City Medical. Willing and looking to take on new patients and help manage the community's health.
All right, and it's good to know that probably not an issue to get in that day if you need to be seen.
Correct.
And that's very important,
Yes,
especially
yes.
when you got kiddos and things.
Yes,
so.
yes, absolutely.
All right, Jill, thank you for joining
Okay.
us this morning.
Thank you so much.
All right, we're back here at the Healthy Fair. We're at Greensburg Elementary School. It is the Decatur County Memorial Hospital annual Healthy Fair, held every June. Morgan's with me this morning.
Good morning, everybody.
Good
I've not
morning.
been on the camera. That's the secret.
She has not been. We've had some great guests this morning.
We have.
We just want to remind everybody that the event will go until 11 a.m. this morning, and there is no cost associated in any way. Lots of screenings going on, a lot of good information that is available.
And of course, everybody's favorites, freebies.
Freebies, lots of freebies. Now, we had some presenters, and that'll continue, I think, throughout the morning. There are some great door prizes, too. I know
Yes.
I talked with Liz about that. So we are just having a good time meeting lots of new providers that have come through. And we have spoken with Rex McKinney, the CEO, and we just want to remind everybody this is annual, and this is a great opportunity for you to come out and join us and get those things done. So,
100%.
and this year, all new is the cancer
Yes.
display. So there's a hallway with walk-through colon, which we're going to check it out here in a little bit.
I'm excited.
And then we're also going to just see, because that is all new this year, and that's planned to continue to be added to. So
Absolutely.
all right. Well, we are going to shift gears here. And again, there's plenty of parking, very easy access into the building. And we are good to go, Liz?
Is this for me?
Yep. Are you ready, Dr. Cooper?
Yeah, Dr. Jamie Cooper, OBGYN. What am I going to do now?
You're on the air. So you can put these on so you can hear me. So how's that?
Great.
Okay. All right. It's all good. I promise.
I've
Listen.
never done this before, so.
Okay, you're going to be great. Yeah, we're just going to talk. I want to meet you. Tell me a little bit about you and your background.
Well, hello. Good morning. My name is Dr. Jamie Cooper. I'm an OBGYN physician at Decatur County Hospital. I've been here about 2.5 years. I worked in the city in Indianapolis. Came from New York City, where I did my training.
Really? Uh-huh.
I'm board certified OBGYN. I've been in practice for about 24 years.
So how did you choose Greensburg?
I was looking for a community with the country. So there was an opportunity, a need. So I got a great offer, and I just love the country more than the city to work.
Yeah, and our community is a nice size to me. I mean, we're not too big and we're not too small, but we have some wonderful opportunities here. So you do OBGYN.
Yes.
So do you keep track of how many babies you've delivered in your career?
I don't. It's been just thousands and thousands because I've been doing this for so many years.
So when you were in New York, was it big hospitals that you were in? That you
Yes.
worked? Uh-huh.
Yeah. I worked in Brooklyn, New York, Brookdale Hospital, and we delivered like 2,000 deliveries a year. It was pretty intense.
I bet it was.
Yeah.
So tell me about women's health care. Tell me some of the things that you feel are important and some of the things that women need to really, because I think sometimes we don't put ourselves first. We're such, we have to take care of everyone else. So tell me a little bit about what you would encourage women to do for themselves.
Well, it's very true because I find a lot of patients who have children or their families, they're taking care of them and they forget about themselves. So they need to take time once a year, do a well visit with the gynecologist, and they do a breast pelvic exam. The pap smear screening depends on the age of the patient. Generally, if they're less than 30, it's every 3 years pap smears. And if it's a patient over 30, we do pap and HPV testing to check for the virus that causes cervical cancer. And those patients, if they're at low risk, we do pap smears every 5 years. However, we do recommend a pelvic exam every year because it's not just about cervical cancer. We screen for uterine cancer, ovarian cancer, breast cancer. I talk to my patients about getting their yearly mammogram, which we start for normal patients at age 40.
Okay.
Family history, they're usually a little bit earlier, possibly 35 years of age. The American Cancer Society does recommend a mammogram every year at age 40. Colon cancer screening, age 45, before it was age 50. So we're staying up with the guidelines. my philosophy is we have our own genes. We're going to get what we're going to get. But if we can diagnose things earlier, catch things earlier, or prevent it from happening, that's the best.
Yeah. And the screenings are the key to that, right?
That's right.
So tell me a little bit about OB care and women that are, because what I see, just my overall, is that we see more and more women later get, like in their 30s, heading toward 40, maybe starting families at that point. So can we talk a little bit about kind of those changes we've seen in the last few years?
Yes, women are definitely having babies a little later because of the work environment, professional, or actually just taking more time to get married and settle down. We do have a lot of patients in their 30s and 40s having babies, but I do encourage people to get pregnant in their late 20s, not wait, because after age 30, I feel like there is a little bit of decreased ovarian function. We used to always say 35. No, in 30, you really need to get moving. We do obstetrics with normal patients and high risk. I have patients that have diabetes, hypertension, previous cesarean sections. We will care for everybody we can. And if I do need maternal fetal medicine, we do consult with the high-risk doctors in Indianapolis.
Okay.
We don't have a NICU here, but we do deliver 36 weeks and above. We have a wonderful OB unit at the hospital on the second floor, which has everything state-of-the-art. Wonderful nurses.
Great nurses, yeah, absolutely.
Yeah, very
yes.
nice. We have a C-section suite, and OR is on the same floor. We have anesthesia. We take care of our patients very nice. We have our family doctors who care for the babies, as well as Dr. Dar, who's our pediatrician for the community. So we do, Dr. Israel and I, he's my partner at the Decatur County Women's Care. And we're located at the new building, the rehab building on the second floor.
Okay, so yeah, you're in the really nice digs,
It's gorgeous.
aren't you?
It's a beautiful office, and the rooms are beautiful.
Yeah. So tell me, if someone's thinking about starting a family and all that, are there some tips that you would give them before they actually, start trying to have a baby, to just make sure that they're at their healthiest?
The main thing is to start the prenatal vitamins about 6 months before, if possible, because of the folic acid, and the vitamins will help prevent neural tube defect. I do encourage people to get super healthy, exercise, try to avoid any smoking, vaping. We're finding a lot of patients that are vaping in the community, and they don't realize the effects of the placenta and the marijuana of the fetal brain.
Sure.
So try to get super healthy, stop smoking, exercise, diet, and take your prenatal vitamins.
Okay, very good. All right, you're accepting new patients?
Yes.
Okay, so they would just call, do they call directly to your office, or do they call through the doc's number?
We do have our office number, or the doc's number. They can reach out. Make an appointment. I do obstetrics and gynecology. Patients with heavy periods, a lot of times we'll give them birth control pills. Sometimes the Mirena IUD. We do an endometrial ablation if in that perfect candidate.
Sure.
Dr. Israel and I, we also do laparoscopic hysterectomies. So we have a lot of patients with fibroid uterus and ovarian cysts that we're seeing that have needed care. So I'm happy to be here in the community.
Absolutely, yeah. Don't feel bad and let those things go, because there is an opportunity to feel much better, right?
Yes, we've had patients. I'm like, oh my gosh, you have been suffering for years with this pain and this anemia, and we could have taken care of you. So please come to the office so we can help you out.
Very good. Decatur County Women's Care, and you're located in the new building on the campus, and so just give them a call and get scheduled, whether you need gynecology services, OB services, it's an annual, get checked out, but don't let it go.
Perfect.
All right.
Thank you.
Dr. Cooper, nice to have you with us today.
Nice to meet you. Bye-bye.
Bye-bye. All right. Hey, we've had a great morning. Mandy Lorum's joining me from the Hospital Foundation. Good morning.
Yeah. Good morning.
The Healthy Fair has been quite a success today.
Yes. We're super excited about that.
Yeah, lots of visitors in here today. So I know the Hospital Foundation is a huge sponsor. And so, Mandy, for folks that don't really quite understand how the foundation works, can you kind of explain that to us?
Absolutely. So we're the fundraising arm of the hospital. So everything we raise funnels into the hospital and helps support our community. So like today with the Healthy Fair, anybody that's getting their screenings done, that is funded through the foundation. So we help support that and provide that funding.
All right, very good. Now, you've been with the foundation for how long now?
Almost 3 years.
Wow. Boy, time's flying, isn't it? Yeah. So talk a little bit about, I know you just recently had one of your bigger events, but talk about kind of how you guys make all this work.
It is a juggling act some days, but the thing is we definitely plan out our events and things around what the hospital's doing and around, other events in the community, so that way we're not overlapping with things. But we had the gala in April, which is pretty a standard thing. Next year will be an exception. We're doing it the 1st of May.
Oh, okay.
Easter falls really late next year, so, we had to push it out to the first weekend of May.
Sure.
Which is not a bad thing.
No, it's not. May is a beautiful month. But tell us a little bit about the gala and what kind of a crowd that you hosted. And
yeah, absolutely. We had a little over 400 people in attendance. We were out at High Point. It was our very first gala in Decatur County.
Which is great.
Yeah, so we were able to host it. We were outside under a tent, so that was part of how we were able to do it here in Decatur County, because there's no building that actually will hold
quite
400.
Big enough.
Yeah.
Yes.
So we did that, and we had our biggest fundraiser of the year for that, and the biggest amount that we've ever raised. So we raised $140,000 this year.
Awesome.
Yeah.
So, and all of those funds then do funnel back into services and things with the hospital.
Yep, just like today's event. So that money goes towards paying for grants to our departments. So our departments have the ability to apply for grants 3 times a year for capital expenses, programming, and stuff that just is important for us to provide. If it's something we need to give access to our community for, just like this Healthy Fair, that's where that funding comes from.
Okay, very cool. So I know throughout the years, there's been so many different people that have been a part of the foundation and that type of thing. But, it has built over those years. So tell us a little bit about how we can get more involved with the foundation as the community and the public.
Absolutely. Well, we have, many different volunteer opportunities. So we have a committee for gala, our annual golf outing, and Tia Fritatas, and that committee helps us to, make those events happen. So community members are more than welcome to be on those committees and help us plan and make that happen, as well as giving to the foundation. That is a very important component of what we do each and every day, and every dollar makes something happen. So every dollar is important. Our budget for this year's $315,000. So that's what we're, striving towards. Yep, we're about $210,000 right now. So we're well on the path for, where we need to be. And those funds are important to the community.
Sure.
We can't provide Healthy Fair. We can't provide Women's Expo that we did in the spring. The foundation, the hospital could do it, but the foundation is what provides the support to make that happen, which is an important component.
All right. So donors, if you're thinking about, because so many people kind of plan out for their year where their monies will go, and some people even with their estate planning. So can they talk with you about how that works and what to do if they're interested?
Yep. I have meetings on daily, if not weekly basis, with lots of donors talking about, where they would like their funds to go. Most recently, we did the Remembrance Garden, which was a partnership with Blake and Amy O'Mara and the Luke O'Mara Foundation. That was, a donor conversation that turned into something that was like, oh, we want something important, impactful, and we want something in our community to show infants that are lost way too soon, and so we were able to partner with them and do that, and that was a $50,000 project. So we brought that to life just from a donor conversation. So there are many routes we go. We have named funds that come about. Our newest one we're getting ready to take care of and get in the works is in honor of Dr. McCullough. So she's retiring the end of the year, and so we'll have all of that information coming out pretty soon about what that fund will do and how that'll work. She's been a staple for forever, and there's a lot of grateful patients that she's served. So that's a brand new fund that we're getting ready to launch.
And that's such a wonderful way just to honor her piece, because she, like you said, she's been such a piece of this community for so long, and I think that's
her legacy
awesome.
can live on.
Forever.
We'll create this fund, and she's actually going to be a part of deciding how it's used.
I love that.
The money's coming from some grateful patients and donors that wanted to honor her and her commitment to the DCMH community, and so now we'll be able to say where that goes through her.
I love it.
Yeah.
That's so cool. Mandy, thanks for joining me this morning. If someone wants to get in touch with you, what's the best way to do that?
So they can call me at 812-663-1220 or foundation@dcmh.net is a simple email. And just a reminder today, if they come out, we are offering free lunch vouchers for those that come through and visit our vendors. There are certain vendors they have to visit, and they're welcome to get their screenings until 11 o'clock.
All right. Awesome. It's just a really great event, and I couldn't do it without the Hospital Foundation.
Well, thank you.
Thank you.
Thank you.
All right, at the Healthy Fair today, it's been a busy morning, but boy, we've had some wonderful guests this morning. We're at Greensburg Elementary School. It is the DCMH Healthy Fair, and we're going to be here until 11 o'clock this morning, but this can't happen without great sponsors. And so I want to welcome Amanda with JC Bank, and you guys are one of the sponsors today, right?
Yes, we are.
All right, Amanda, tell us a little bit. Now, you guys have recently came to the Greensburg community with JC Bank. So tell me a little bit about you first.
Sure. So I'm originally from outside of Hope, and I moved to Decatur County about 10 years ago. And I'm very happy to live in the community that I work in.
Very cool.
And as far as personally, I'm married with 2 wonderful children.
There you go. How old are your kids?
17 and 13.
Okay, so you're a busy mom.
Yes, ma'am.
Keep you running. So tell us a little bit. Down JC Bank opened. What was the date you guys opened?
We opened on December 19th.
Okay, so you're like the new baby in the community, and you're located over on Lincoln Street, beautiful building. And your position there?
I'm the banking center leader.
Okay, so tell us a little bit about some of the services that are offered at JC Bank.
Sure. So JC Bank is a full-service community bank. We are one of the few banks that offer a trust department, and we have exceptional CD rates and savings rates. We have free checking accounts. We're just completely full service.
Okay, and so I know where you're located at, you've got the drive-throughs, you've got the night deposits, you've got all of the things that we need. And so tell me, inside the bank you have how many employees, and is there a loan officer? And just give me some ideas of what people will find when they come to see you.
Sure. So there's 5 employees, including myself, on the retail side. So we have 3 tellers. I have an assistant manager. We have an investment advisor that sits at our location, a mortgage officer that services, and we have commercial lending.
Very cool. So how long have you been in banking?
I've been in banking for around 17 years.
Have you really?
Yes.
Okay, and you've been with JC Bank how long?
It'll be 5 years in July.
All right. Now, where is their main branch?
In Seymour.
Seymour. Okay. And how many different locations do you have with JC Bank?
13.
Okay. All right. Very cool. All right. So tell me a little bit about being a sponsor here at the Healthy Fair.
So we're very excited to be a part of the Healthy Fair. It is just a fantastic opportunity for us.
I love it. And we talk about the community, and it takes everybody to make it all happen.
Yes.
And so everybody is, thrilled, like these kinds of events where it's free to the community, but it can't be done without the sponsors that help out along the way with it. So,
yes.
So what are the hours at your banking location?
So we're open Monday through Friday, 8:30 to 5, and then we're open on Saturday from 8:30 to noon.
Okay, and on Saturday, do you have walk-in hours or drive-through hours?
Both.
Both. Okay.
Yes.
All right. Very good. So if somebody heard us on the radio and I said, just stop at JC Bank and see Amanda, you'll be there.
Yes,
Take
ma'am.
care of them.
Yes.
All right. Sounds like you've got a wonderful array of services to offer. So we'll encourage everybody to stop in there and check it all out.
Perfect.
So, thank you for joining me today.
Thank you for having me.
Yeah. All right. Thank you, Morgan. Morgan's been helping us out all morning here at the Healthy Fair, and we still have until 11 o'clock. So if you have a minute to come on out and you haven't been here to get your labs, you can do that. We're at Greensburg Elementary School, so easy in, easy out. No cost for anything associated here because we have some awesome sponsors that have helped out. Dawn's joining us from Franciscan Health. Good morning.
Good morning. Good
It's
morning.
nice to have you with us.
It's
So
nice to be here.
tell us a little bit about you and about your role with Decatur County Memorial Hospital.
Well, I work at Franciscan Health, and I work with our cardiologists who come down here to Greensburg and have a clinic here. Franciscan Physician Network, Indiana Heart Physicians. Our cardiologists have a clinic in the hospital in Greensburg, and it's a great partnership that we have with the hospital to take care of patients in the community.
So is there a cardiologist just about every day available at DCMH?
Yes, we come to DCMH 5 days a week. Our cardiologists are here in the clinic in the morning. We also have a new physician assistant who joined the group down here. She's been working with us for 25 years, so she's excellent and sees patients in the morning and in the afternoon.
Oh,
so
wonderful.
we have added a lot of capacity of access so that it shouldn't take long to get an appointment with us.
You know, that is a piece, and Rex and I talked about that earlier. A community our size is so fortunate to have the opportunity to have these visiting specialists, and because a lot of times travel is an issue, or your health is an issue in having to travel. So, can you share with me which physicians come down to visit?
Yes, we have Dr. Polly Moore. She's one of our cardiologists, and Dr. Derek Plain, Dr. VJ Rao, and then our physician assistant is Suzanne Stiller. So they're here. One of the cardiologists. They rotate some.
Oh, okay.
Dr. Moore is here the most, but yes, it's always here 5 days a week, all year round.
That's
So,
wonderful.
Yes.
So, Franciscan Health, I'm going to have you just give a little bit of a background for maybe, I can't imagine at this point, but maybe someone that's not real familiar. Can you tell us just a little bit about Franciscan Health?
Sure. Franciscan Health is a ministry-wide in Indianapolis where we are part of a 12-hospital system. We have our hospital in Indianapolis. Our main central Indiana campus is on the south side of Indianapolis, kind of Greenwood area.
Right off 65-ish
Yes,
area?
if you drive past on 65, you'll see Franciscan Health right there. Also, we have a hospital in Mooresville. We have an orthopedic hospital in Carmel. And then we have other hospitals up, like I-65 up in Lafayette and northern Indiana. So we're part of a system. And we have multi-specialty practices that work at Franciscan, so there's a lot of options for care.
Sure, absolutely. All right, so you guys are one of the sponsors of today's event, and just talk a little bit about what that means to you.
Well, Greensburg is a wonderful community. Decatur County is a great place. I've been working with the cardiologist, and I've been coming down to Greensburg for since 2012.
Oh, wow.
So
Yeah.
I feel like I know the people down here. I know the community. I just try to make sure that all the resources are here that everyone needs so that they can stay local. So anyone who has a cardiology appointment, if you have to have a test, if you have to have an echocardiogram or something like that, you can stay here in Greensburg. It's only if you need a procedure or something that can't be done here that you would travel to Indianapolis to have that done. But it's a great partnership. We really appreciate it. We enjoy working with all of the staff here. We participate in the community events, and even Suzanne, she lives not too far from here, so it's her community too.
Awesome. Well, like I said, we're very fortunate to have these physicians that come to the community and just make life a little easier for everybody. And so one thing I do want to know, if we need services, do we need the referral from our physicians, or is there a way to get scheduled in?
Well, if you have a primary care physician, that's the best route to go. If you have a primary care that's monitoring your health and you need to see a cardiologist, they can refer to the cardiology practice, or you can self-refer. So sometimes people who do a heart scan for the $49 heart scan, which is a great thing to do. It's a good way to identify your risk for having a heart attack. But sometimes people have a heart scan and then they can self-refer to the cardiologist. So you can call, depends on your insurance, but most insurance allow people to refer themselves to a cardiology practice. But it's best to be with a primary care so that they're monitoring your overall health, so that if you do need to see a cardiologist, you can. But again, you can self-refer if you feel like you need to see a cardiologist, or if you are seeing a different one and you want to switch to just get a second opinion. So sometimes you may not, you want to make sure somebody confirm that, what you've been told, that you want to get a second opinion. You can do that too.
Sure. Okay. Is there, can they do that through the DCMH line, or what's the best way to make that contact?
No, well, we have, you can call the hospital and get to our clinic, but our scheduling is a central scheduling. So it's a phone number for Indiana Heart Physicians.
Okay.
And it's over at my table.
It's okay.
I don't have it memorized.
It's okay. We can just get them through the DCMH one and send them your direction then and get that appointment made.
Yes, you can.
All right. Dawn, thank you so much for joining me this morning, and thank you to Franciscan Health for sponsoring and making this happen.
Thank you for the opportunity.
Thanks. All right. I think we have had a heck of a morning. It's been good.
It's been very good.
Yeah. Liz McCoy joining us from marketing at DCMH. And, you've had a very nice event and lots of folks through the doors.
We have definitely had quite a few people that have come through the doors. We've been able to do a ton of free screenings that we've provided out to the community. We still have the vendor booths that are going on. Lots of people here. I'm sure you can hear the background noise in the gym.
Yeah. So the way it works too, there's a free lunch involved if you kind of do your visits to the booths and all those things, right?
Yep. Or if you come in just to get the free lab draw screenings.
Oh, okay. All right. So you have any idea about how many have been through the lab?
I'm not sure right now. I know in the first hour we did more than 100.
Okay, very
so
cool.
We're still going. We're still here until 11 o'clock. And if anyone out there is listening and you'd like some information about your health, how you're doing, where you're at, please make sure you stop into the Greensburg Elementary, and we'd be happy to get you in and get you with our team.
Directed. It's been nice this morning. We've met several of the new providers, caught up with a few of the folks that we've known from other times, but to me it's very eye-opening when you look at the amount of services available and like the specialties. I mean, there's a lot going on at DCMH.
There is a lot going on at DCMH. And I feel very thankful, very appreciative to that entire team. We've had so many of our specialty services that have been able to show up here today to meet and greet with the community, with each other. Sometimes, even within the hospital, we all get very busy in our own areas, and
this has been an opportunity for me to kind of help introduce them all to one another too, especially some of our new providers.
Sure.
So there are a lot of different specialty services. We're continuing to grow some of those specialty service lines. That way you can get the care you need close to home. You don't necessarily have to travel really far away. That's one of our big goals. And then, of course, being able to have many different providers that are practicing in that family medicine area.
Yeah.
Great for primary care providers, whether it's kind of a simple wellness visit or if you've got some kind of a chronic chronic illness going on, that they can kind of help manage with you and partner with you. So,
and it's nice to know, and Rex and I were talking about the fact that they've added more and more providers, but that you have access to care when you need, because you hear the horror stories, well, we can see you in 4 weeks, or I'm sick today,
Right.
and that's like a mom's worst nightmare when you have a sick child and you don't really have options out there.
Right. And it's because then you're left in this moment of, what do I do? How do I help? So we've got many different, each one of our different clinics now is able to offer same-day appointments. So you can call in, talk to the person on the phone and say, I need to see someone today. They'll be able to get you in. We still always have the immediate care that's open 7 days a week. They have extended hours that they do even on weekends. So again, it's to try to make sure that if you ever have a need, that there is someone here who can answer that call, help you figure out what's going on, and help you get to feeling
much
good
better.
again.
Yes. So we have Tree City Medical,
Yes.
Decatur County Primary Care, Decatur County Family Medicine now over in the new building. We've talked with Women's Care. We have awesome resources in the community. So, but thank you for, it's lots and lots of work to put this event together. You've done a wonderful job today.
Thank you.
And I don't know how many years the health fair has been going on.
I'm not sure either. Actually, there's another person who's here that she used to run the Healthy Fairs too. So I know it's been going on for a very long time in our community.
Yeah, it has evolved and but there's a lot of representation from the community here, and that makes it nice too. So let's talk a little bit about sponsors. I know we talked with Mandy Lorem from the foundation and JC Bank, but it takes everybody and then some in order to make sure that all of this can happen, and it's wonderful community support.
It is. I mean, the amount of community members who come together to help put this type of an event on for our community, it's heartwarming to see. And we have so many of our DCMH staff members that have volunteered to come here today in order to make sure that this will be a success, that it feels fun to me. So I hope it's feeling fun to everybody else who's getting to come here. Not only are you getting good information, not only can you meet lots of different people, but you can also have a little bit of fun while you do it. But we are incredibly thankful to all of our sponsors that we had. So as you mentioned, you talked to Mandy Lorem with the Hospital Foundation. We also had our sponsorships from Honda, the Napoleon State Bank, Aspen Place, United Fund, Franciscan Health, which you just talked with Dawn just a little bit ago, JC Bank, which you also talked to, and then Levenstein. So we're very thankful and appreciative to all of those sponsors.
Yeah, helped to make all of this happen.
They really did.
Yeah, and community wellness is what it's all about, and the opportunity to have these things done, and find the care that you need, even if you feel like you can't afford it, or then there are options, and you guys can help them get on the path that they need.
Yeah.
So. All right. Well, Liz, it's been good.
Thank you so much for coming.
Oh, we've had a blast.
Thanks to all of the people who came today too. I hope they hear this. I hope they've been here, or anyone who's listening. They're on their way here.
That's right. And then we want to remind everybody there's a lunch involved again.
Yes.
But you need your cards marked at the balloon booths, right?
Yep. Or to go ahead and get the free screenings. Either way, we'll get you a free lunch voucher. And part of that, again, is thanks to our sponsors who helped make that possible.
Yeah, I love it. All right, anything, I know you just worked yourself to death on this one, but next big event coming up?
Fair Week, yeah. So that's probably our next big event. We've got several other things in between now and then, but you're always looking for what's the next thing that we've got coming. So
stay tuned, right?
Yes, stay tuned.
All right, Liz McCoy with DCMH Marketing, and thank you again for having us out today. We've enjoyed it.